Hey y'all, today we're going to be going over bony and muscular palpations of the hip and pelvis.
Within those palpations, we're going to show you guys about 10 of those today, and a lot of them fall under groups, so we're going to try to keep those together the best that we can.
Always remember that before you start to palpate or touch your patient, you always have permission and you let them know what you're going to be doing beforehand.
Okay, so the first palpation we're going to be having today is going to be a bony landmark, and it's going to be your pubic symphysis. This bony landmark typically it's not going to be able to palpate because it is in the area of discretion, but it is important to know where it is, just the fact that it's a very common site for referred pain. So as a clinician, if you do have to look for this landmark, you need to make sure you have your patient's discretion first before moving forward. Okay, so the next palpation we're going to do is a bony palpation as well. And that's going to be known as your anterior inferior iliac spine, or your AIIS. Okay, so what you're going to do is first you're going to find your patient's ASIS, or your anterior superior iliac spine. And then from there, you're going to want to move slightly inferiorly. And then from there, you're going to want to go slightly medially. And as a patient is laying down, you're going to more so feel the musculature or the tendon for the origin of your rectus femoris. If they stand up, you'll be able to feel the bony prominence a little more. But either way it goes, this tends to be a deeper palpation, so you're going to have to apply some kind of pressure to your patient in order to feel it. Okay, so now we're going to move on to our first muscular palpation, and we're going to start with your rectus femoris, which is the medial most superior quad muscle that you have in your leg. Okay, so as mentioned before, your rectus femoris is going to originate at your AIIS, so you want to once again be able to find where that bony palpation is, and from there it's going to extend along the anterior aspect of your thigh, so it's going to go all the way down, and it's going to insert here at your quadriceps tendon along with the rest of your vastus group of your quads. Okay, so the next palpation we're going to get into is going to be your sartorius muscle. Okay, so for this muscle, it's going to originate at your ASIS, and from there, it's going to go straight down, and then you're going to start going diagonally across the anterior aspect of their thigh, and then it's going to insert on the medial aspect of the tibia, also known as your pes anserines, which is also the insertion point for your gracilis and your semitendinosus muscles as well. Okay, also to find your patient's sartorius, you can also move them into a figure 4 or Faber's position, and what that means is you're going to put them into hip flexion, then hip abduction and external rotation, and from there you should be able to feel the sartorius going along the medial aspect of their thigh. The next muscular palpation we're going to move into is going to be your gluteus medius. Okay, so your glute medius muscle is going to originate at your bridge of your iliac crest, and that's going to be right up here along the lateral aspect of your leg, and then it's going to insert at the greater trochanter. And if you want to have your patient internally, externally rotate your hip, it'll be easier for you to find it. So it is right here, I can feel it in my finger, the head is moving back and forth, and between this space right here, that is going to be where your muscle is.
The next musculature we're going to be palpating is going to be your adductor muscle group. This is going to be composed of your adductor magnus, your adductor brevis, and your adductor longus. So to make the adductor group easier to palpate, we're going to have the patient lie in the figure 4 position. All the adductor muscles are going to originate at different points of the pubic bone and are all going to insert at the linea aspera of the anterior portion of the femur. So all the adductor muscles would be in this area right here. Note that the adductor brevis also inserts at the pectineal line, which is a ridge next to the pubic symphysis. So to find these muscles, you're going to start off at the inguinal line of the pubis, and you're going to walk your fingers down the entire medial aspect of the patient's thigh, and those should be your adductor muscles right there. So our final palpations are going to be our tensor fasciae latae and your iliotibial band, or also known as your TFL and your IT band. So for this palpation, you're going to have your patient in a side lying position. The TFL is going to essentially turn into the IT band, so they're both going to have the same origin and insertion. They're both going to originate at your ASIS, and they're going to insert at the lateral epicondyle of your tibia. So both of these musculature are going to run down the lateral aspect of your thigh. So you're going to find your ASIS, find the lateral epicondyle of your tibia, and you're going to run your fingers down that lateral aspect, and right there should be your IT band and your TFL. That concludes the palpations for the hip and pelvis.
We hope you guys learned something, and thanks for watching.